My involvement became first when I first met Mr. Rappas back in, I think, early May. We met in the office,
Right.
and then at that point is when he described that he was starting to go downhill. So when the decision was made to perform the LVAD procedure, or the device to support the left heart, we went into that realizing that it would be a temporary process, and with his disease process, as he described, it wasn't going to be something that was going to get better. Knowing how active and how good a health he was before, he would be an ideal patient for ultimate cardiac transplant. He happened to be the 800th transplant, which, as he's already described, there's only a handful of centers in the United States that have reached that. And with our program, with the excellent results we have, I mean, that's how we built this program to what it is. The thing that really drives all the staff, nurses, physicians is basically the effect that this has for the patients to go on with their lives and to really be back to so-called normal. Mr. Rappas, as you know, he has many things he wants to still accomplish in this lifetime, and unfortunately he's going to be able to do that and do it well and feeling well. And so, for us, that's the gratification we get, and that's why we do this. The transplant program at St. Luke's is a long history back in the mid-'80s that actually became the first transplant center in Wisconsin. We, at the very beginning, was involved also in development and working with the new ventricular assist devices throughout the history. In fact, our first history of LVAD insertion was back in 1990. So really in the infancy of the whole process of assisting failed hearts with devices. This is a community-based tertiary care center. I mean, you don't find this kind of care or expertise in many other centers. We're very proud to say that, St. Luke's here in Milwaukee is at the forefront of, transplantation as well as left ventricular assist, care.